oxygen is increased. Such demand once been increased, supply also need to be increased. That's why you can just see that heart needs to work more, heart rate has to be increased. So what is the effect, physiological effect of thyroid hormone? The heart rate gets increased. Similarly, to supply the oxygen, the ventilation, that is rate of respiration, also need to be increased. Second very important effect of thyroid hormones, heart rate increases, cardiac output increases, the rate of respiration increases. Remember that this is a catabolic hormone, right? Very initially in endocrine system we have learned two major types of hormone could be there: anabolic hormones, catabolic hormone. Thyroid hormone is a purely catabolic hormone, so it increases the catabolism of carbohydrate, fat, protein. Such a case, it will also increase mobilization of such molecules, and it will also increase the appetite, because now these molecules are getting converted into energy, right? Once you have increase in oxygen, increase in the metabolic rate, the synthesis of ATP will increase. You know that synthesis of ATP is a thermogenic process, it's a calorogenic process. Mobilization of all these molecules also will lead to the same. Such a case, body temperature increases on upper margin, right, on upper level. So that's called as a thermogenesis. Thermo refers to heat, genesis refers to formation, right? So heat formation increases. So these are all a very important effect, right? Very simple effects that you can observe, right, as a symptoms, right, in patients of hyperthyroidism. Say for example, if I just want to correlate this normal effect, so in case of hyperthyroidism, body temperature must be high, rate of respiration high, the heart rate again on the higher side. It's a catabolic hormone, that's why the fat present beneath the skin, right, that's what we call as a subcutaneous fat, definitely decreases, because lipolysis will be produced, so skin will be thin, right? Such all effects you can observe in patients of hyperthyroidism. On the counter side, if patient of hypothyroidism is there, definitely these all effects are compromised, right? So what will be the effect? Just opposite to hyperthyroidism, you can just think metabolism rate will be increased, catabolic effect will be decreased, so there will be accumulation of fat. Yes, accumulation of fat specifically in the skin, beneath the skin. That's why the skin becomes loose and the subcutaneous mass become increased. That's why they have a very thick skin, right? Reduced temperature, right? The rate is decreased, BMR is decreased. That's why patient become obese, right? So these all are lazy, right? Fatigueness, right? These all, because that's as a symptom you can observe in case of hypothyroidism, right? So if you are able to recall the pharmacological or physiological effect, right, you just can make a correction here. It's actually a physiological effect. So physiological effects are very important. Then and then you will be able to correlate the symptoms of the disease either in hypothyroidism or in the hyperthyroidism, right? Now moving towards next slide, that is daily requirements of iodine. So as we have said that it's a trace element, and your body needs almost 120 microgram every day for the production of the thyroxine. Such a case, it is recommended that to have such and such iodine, right, in your actual concentration in your blood, you need to take a 200 microgram per day either in your food or in your water, right? And if the quantity is less than 50 microgram per day, it may result in thyroid deficiency, right? Those who are living near the level of the altitude of sea water, right, there you do not find the problem. The problem is in the areas which are hilly, right? Say for example areas of Leh Ladakh, areas of Himachal Pradesh, right? So hilly areas, because it is iodine is present in the upper layer of soil, whenever you have rainwater, and that takes away the iodine which is water soluble, and that's why deficiency of thyroid or deficiency of iodine could result in such case, right? They do not have iodine in their food and water, and that's why they need to take it externally. It is very important to note that government has made it compulsory. Such a case, now we are having the presence of iodine in the cooking salt. We'll check also that in the next slide. Hyperthyroidism, if the thyroid hormone are synthesized in more amount. Hypothyroidism, very easy, if thyroid hormones are not synthesized in a sufficient quantity. So moving towards the types of hypothyroidism, we have checked this, that if there is lack of iodine in the diet, it will result in an compensatory enlargement of thyroid gland, right, in the neck region. It's a characteristic symptom of the simple goiter. Why? Because once you don't have iodine in the food and water, such a case blood also will have lack of iodine, and such a case there will be hypertrophy of and hyperplasia of the follicular cell, so as they try to take a trace quantity of iodine if it is present in the blood. To have such type of an adaptation, they increase in the size, and that results in enlargement of thyroid gland, right? That's called as a simple goiter, right? It is also called as an endemic goiter or colloidal goiter, right, because it is localized to specific areas, right? And you can also make a very simple assumption: wherever hilly areas are there, right, that is all hill station, those are referred as goiter zones, right? Person eating seafood, because seafood is rich in iodine, definitely will never lead to hypothyroidism, right? Yes, this is another abnormality which is called as a cretinism, right? Previous one was because of the dietary deficiency. If such dietary deficiency or any other reason, right, that because in pregnancy the demand of each and every element, food material is more, right, and if iodine deficiency is there, definitely it will lead to hypothyroidism. It could be genetic also, it could be because of the food deficiency also. But such a case, if it is in case of pregnant woman or if it is in case of childhood, such a case it may lead to not only retardation of the physical growth, but also it will lead to decrease in the mental capabilities. Remember that the growth of neurons maximum is within 4 to 5 years of the initial lifespan. Such a case, without iodine, the proper development of neurons cannot take place. Such a case, such childs, right, which are having hypothyroidism, they will have idiocy or imbecility, right? So that is result in a low IQ, and such low IQ are, that's why iodine is very important, right? We say about physical growth, BMR, basal metabolic rate, but also the IQ gets affected. Such a case, it is resulting in a specific disease called as a cretinism, right? So cretinism, signs and symptoms I have mentioned here. Skeletal muscle growth is retarded. That's why, just like deficiency of growth hormone, here dwarfism could take place. Smooth muscles, definitely they are not retarded, right? Their growth is not retarded in absence of thyroid hormone. That's why they will continue to go. In such a case, the patients of cretinism, the skeletal muscle, that's why limbs, lower limbs and upper limbs, they are not grown, but the you can say the smooth muscle, that is your intestine, stomach, that is grown properly. That's why the appearance of child is pot bellied, right? It looks ugly, right? Muscles also are weak, and sexual organs are not developed properly, so it could result in a sterility, or secondary sex characteristics are also in absent, right? If hypothyroidism is developed in case of adults, it's called as a myxoedema, right? Myxoedema is because of the characteristic appearance. As I told you, there is an increase in subcutaneous fat, which gives a characteristic appearance of loose and swollen skin, and that is actually symptom wise we also call it as edema, right? Edema refers to swelling, right? So just because it is swollen, that's why the name is edema. Myxoedema is given the name from this symptom, that is there is an increase in subcutaneous mass, right, in fat in the skin region, and such a case definitely it will result in a loose and swollen skin, right? Similarly, BMR is less, blood pressure is reduced, there is a falling of hair, person becomes obese. These are all symptoms of myxoedema. What is the difference between cretinism and myxoedema? Cretinism is developed in case of children, right? Myxoedema is in case of adult, right? If the hypothyroidism is because of autoimmune origin, that will result in inflammation. Wherever there is an inflammation, we will call it as a ITIS, right? And inflammation in thyroid follicles, that is because of autoimmune region, is called as a autoimmune thyroiditis, that is Hashimoto's disease, right? So in case of hypothyroidism, we have learned simple goiter, we have learned cretinism, we have learned myxoedema, and finally Hashimoto's disease. These all can be asked in 1 mark definition or explain type question, okay? Finally, hyperthyroidism. Hyperthyroidism, the subcutaneous mass of lipid is reduced, person is thin, body temperature is high, also because of less fat, right? The eyeball are being protruded outside, right? So that is exo refers to outside, and ophthalmo, here there is a spelling mistake, you can just correct it. So exo, ophthalmo refers to eye, right? So exo means outside, because the eyeballs are being protruded outside. That's a characteristic symptom, physical symptom, from which you can recognize, you can identify. That's why it is called as a exophthalmic goiter. Or from the on the basis of the scientist who described this disease, it's also called as a Graves disease. Thyroid hormones are in toxic level in the body, that's why it is called as a thyrotoxicosis, right? So this is hyperthyroidism. Treatment very easy. Wherever hypothyroidism is there, it is recommended that you should take thyroid hormones on the basis of advice of doctor. Normally it is levothyroxine in various doses, right? That is decided by the endocrinologist, are recommended to the patient. Similarly, some cases like goiter, iodine compounds like sodium iodide, potassium iodide can also be used. Definitely to prevent such disorder, iodized salt in food will serve the purpose, right? Hyperthyroidism, you will learn in higher semesters that some drugs which are called as anti-thyroid drugs like carbimazole, methimazole, these drugs can block the enzyme thyroperoxidase enzyme. They can give relief, right, in the signs and symptoms. Okay, in case of cancer of thyroid, radioactive iodine I-131 can be used, right? So this is all regarding the details of the thyroid hormones and thyroid gland, right? Please do refer this topic in detail. This is very much important as far as the knowledge point is concerned, exam point of view is concerned, right? Just for your information, your cooking salt, as per your WHO recommendation, it contains 1 part of iodine in 1 lakh part of common salt. That is 1 gram of sodium iodide in 1 lakh gram of NaCl, right? This is what the cooking salt is actually having. If you have any question, you can just contact me through my WhatsApp, right, or by any means of social media. Thank you very much.